So what we're doing today is Botox jaw reduction. Essentially what this is done for is two indications. One is TMJ, temporal mandibular joint problems, functional issues where they have pain, tension, etc. And also sometimes done for wide face. She obviously doesn't have a wide face, but that can also slim this a little bit. That takes a few weeks to occur. So let's talk a little about what this procedure involves. So this procedure involves injecting injecting the masseter. Now what I've done is carefully mapped out the masseter. It's a gentle palpation, fancy medical term for touching, a gentle palpation of the area, finding where the masseter muscle is. It's very important to map the masseter muscle out because if you go too far in advance, in front of it, you can hit this muscle called the risorius muscle that can cause the smile to be slightly off for about 3 to 5 weeks. And I tell all my patients that can occur. It's a temporary issue. It still can occur even with a careful mapping, but the good news is temporary. It happens in probably 1 in 200 patients. Other complications or issues that I've seen, you can have a bulge that comes out if they bite down. That happens probably 1 in 50, 1 in 100 cases. Easy to fix. I don't charge for the fix. I just take a drop and inject that and manages that. And the other issue is sometimes it causes secondary pain as well. So in other words, the large principal pain is addressed so much that when the patient is done, all of a sudden they start, I'm starting having a little more pain over here. What's going on? That's because I've managed the first pain so well, the second pain shows up. The other thing that I've mapped out here is that the TMJ, the joint cavity is actually inflamed and popping. So I've distributed about most of the injection over the masseteric muscle itself and a little bit up here. What's interesting I'm going to do some injections where she shouldn't even feel the needle go in because I'm really good with my injections. Because a vibration technique, the way I do it is the vibration is so strong that your brain gets a busy signal to it, should barely even feel it. So let's give me some ice first. That also helps minimize that. Then what I'm going to do is I ask a question. There's several questions I'm going to ask her. So before I start, what I'm going to do is inject both sides, and I'm going to ask you, shouldn't feel needle, but do you feel a little bit more pain when I inject it, which is a sign of inflammation. So I'm going to go and inject this here. Okay. Okay, bite down, stay clenched for me. Good, stay clenched, don't let go of the clench. Keep staying clenched for me. Don't stop, don't stop, don't stop, don't stop, stay clenched. Now I want you to open your mouth wide. Stay right there, please. I'm feeling the joint capsule and injecting that. Okay, let's go to the other side, turn this way. Stay clenched for me. Good, stay clenched, stay clenched. And that crazy wiggle technique is that she should barely feel this. Open your mouth, going for that joint capsule right there. And I don't always inject the joint capsule. So relax. Did you feel a little more discomfort on one side or the other?
I think this side was
okay, a little more comfortable. So the reason I asked that question, even though I'm really good with needles, the muscle that's inflamed or the joint capsule that's inflamed can be more symptomatic. And I ask that is because I want to see which side is more of a problem. Also, in about 6 months when we repeat this, I'll ask her again, do you remember last time which hurt more? She, oh yeah, this side on the right hurt more, but this time I didn't feel anything. It means that the inflammation of the muscle and the joint capsule is going down. Open your mouth for me. Do you feel any difference?
Yeah, it doesn't hurt as much.
Interesting. So that's the second question I ask, is that if I've really got it right only in about the top 10% who have really bad, I hate to say you probably have pretty bad TMJ, because when she's getting instant relief, that means that TMJ is pretty bad. When I'm dealing with patients that usually go, oh, I don't feel any difference, it means they're probably in the top 80% where they're not feeling much pain. What's really interesting, you saw this is a real-time video. This is only a few seconds after I injected. I asked her, how did she feel? And she immediately said she felt better. That is really weird because I'm actually sort of an expert on Botox for pain, where I've injected Botox for pain, for migraines, for neck, back issues, legs, knees, fingers, toes. It's crazy how I can actually manage pain. And I found something very unique is I get instant pain relief with Botox. It's very weird how that happens, but Botox actually provides instant pain relief if you nail it correctly. Open your mouth again. Do you feel a little bit better? Mm-hmm. Better than a few seconds ago, right?
Yeah.
Now that's really interesting. If you look at animal studies, it says that the minimum time for Botox to bind into the neuromuscular end plate in animal studies is about 12 minutes. In humans, it's closer to 90 minutes. Well, this is a few minutes. So I can even get it within a few seconds. And this will continue to relax for her. And it's really weird because the Botox is, there's no way that Botox is actually bound to the neuromuscular end plate at this much speed. But something is happening to the nerves and there's a reconditioning that's occurring really fast, and that's giving me feedback of what's going on. And I've had patients, not to be arrogant about this, but I've had patients go elsewhere and they try to save a couple $100 and do it somewhere else, and they don't get the results. They've been to dentists, they've been to people who do this because they don't understand anatomy. And I do this every day, almost every single day, so it's my expertise. So if you're dealing with a lot of chronic TMJ pain, if you're dealing with wanting facial slimming, which we really didn't talk about much today, come and see me. It's a really easy, painless experience. You know, I know you're not getting paid to say this, but it wasn't that bad, right, pain-wise?
No, it didn't hurt
Yeah.
at all.
It should not hurt. I'm incredibly good with needles. If you're incredibly scared with needles, I really can manage this with it in a painless way.